Hi, my name is Heidi, and I'm soon going to be graduating as an occupational therapy assistant. Throughout my college career, I've been asked many times, what is occupational therapy? I'd like to start by telling you what it's not. Some common misconceptions are that occupational therapy is helping someone who is hurt on the job or helping someone find a job that they're happy with. So in order to tell you what occupational therapy is, I'd like to start out by defining occupation. An occupation is any ordinary and familiar thing that someone does from day to day. Examples include eating, showering, driving, working out. It's different for everybody. For some people, it might even be something like surfing or mountain climbing. When someone is injured or has an illness that affects these areas of life, occupational therapists use skilled treatment in a variety of settings to help people get back as much independence as possible in these areas. We use multiple treatment methods, adaptive equipment, home modifications, and education to assist patients and their loved ones throughout these times of change. An OT practitioner can be found in many different settings. They include rehabilitation facilities, hospitals, long-term care facilities, mental health settings, industrial settings, and education systems. In these different settings, we work with people of all ages, and there are many special areas of interest. They include, but they're not limited to, hand therapy, pediatrics, working with burn patients, someone who suffered from a stroke, central nervous system dysfunction, and many more. Now that we've talked about what occupational therapy is and where we practice, I'd like to show you some examples of some of the activities that we use to help people get back to independence with their areas of occupation. The most familiar area is probably physical dysfunction. If somebody breaks an arm, for instance, has a fracture, a sprain or a strain, we're going to use different strengthening exercises with them in an outpatient setting. We'll use something like TheraBand in order to strengthen them. We'll also use different modalities such as hot packs, E-stem, TENS unit, and in that setting we would also use something like a splint possibly. As occupational therapy practitioners, we do design splints and we even make fun colors if that's what the person likes. So that's kind of what we would do in a physical dysfunction setting. We also use different activities if somebody's had a stroke, for instance. This is called the Allen's Cognitive Level Assessment, and I don't know if you can see, but we have different loops here. And depending on if a patient can make a simple loop or a complex loop right here, that can actually determine whether or not a person is safe to live at home, how much supervision they might need. So this is a really good standardized assessment that we'll use as occupational therapy practitioners. We also work with children, and here we have some Play-Doh, which is just a really common object. But we have a lot of kids that have sensory dysfunction, and sometimes they squeeze too hard if they have different deficits. And this is something that they can learn, like, oh look, you've got your fingerprints in it, so you're squeezing too hard. So we just kind of teach them by using something like Play-Doh, their pet, how to touch it appropriately so they're not going to hurt anybody or anything. And this also is just something fun. Kids like to use Play-Doh. Some of the other areas that we work with, as I mentioned before, were psychiatric dysfunction. We do things like making a little collage, and it kind of brings out what people are feeling, things that they enjoy doing, and sometimes can just kind of get those thoughts and emotions going that are tucked away in there, and it can be very therapeutic. And it's also a good warm-up activity for group. And occupational therapy does a lot of group therapy in the mental health setting. We have another activity here, a game, and this could be used for a variety of things. Chess is something that takes a lot of thinking skills. So if somebody's had a traumatic brain injury, for instance, and they have a really high-level corporate job, or they need to get back their decision-making abilities, we could use this when they're closer to recovery It's also just a good game for somebody who needs to build some social skills. If they have a psychiatric dysfunction, this is going to be good to kind of get them doing something one-on-one with somebody. And sometimes it's just therapeutic for somebody who's had a stroke. If this is an activity that they were familiar with before, if they are affected on the right side, we're going to try to get them to incorporate using their right hand to play that game. Because research shows that when we use these different activities, people are much more likely to recover than when you're just using therapeutic exercise alone. If I need them to work on fine motor coordination and they're not able to pinch, I could have them sit here and pinch the Play-Doh, and that is going to give some strength. But if I can get them to do that same pinch using a game or an activity that they enjoy, they're going to work at it a little bit harder and a little bit longer than using the Play-Doh. So that's where occupational therapy is different, and that's kind of what sets us apart. Now you've seen some really good examples of what occupational therapy is and what we do. So next time you're wondering or you hear someone ask, what is occupational therapy? Remember, occupational therapy is not about getting jobs. It's about providing skills for the job of living.